Artificial intelligence is increasing the number of claim denials. Patients are on the warpath. Here are 3 things you can do today to help your patients as well as help your medical practice. Prioritization is a process that has evolved from a simple checkpoint into one of the greatest sources of administrative burden, physician burnout, and delays in helping patients. Doctors hate it, patients hate it, but insurers love it. Is AI dismantling this bottleneck or is it making it worse? Well, today we're going to do a deep dive in how artificial intelligence is being deployed to automate prioritization and what that means for your practice, your staff, and your patients. There's substantial evidence that artificial intelligence is indeed increasing the number of claim denials in the healthcare industry currently. According to the American Medical Association, claim denials has skyrocketed from 8% to 11% between 2021 and 2023, a staggering 37% increase in just 2 years. The timing of these increases correlates directly with AI implementations that we've seen throughout the years. United Healthcare, unfortunately, is at the lead of the pack. Their denial rate for post-acute care rose from 10.9% in 2020 to 22.7% in 2022 as the company started to shift toward more automated processes. This dramatic increase followed the implementation of the AI algorithm called NH Predict. United Healthcare has led the industry with a staggering 33% claim denial rate. While most insurers like Cigna, Aetna, Anthem Blue Cross, Blue Shield have denial rates ranging between 17% and 30%. In fact, United Healthcare is such a lead in this area. We had a tragedy that happened not too long ago with the United Healthcare CEO, unfortunately meeting his untimely demise on the hands of someone who claimed that United Healthcare was denied their coverage. This is a terrible thing that's happening right now with these insurers preventing patients from getting the care that they need. And as a medical professional, I know your heart goes out to patients because you want to give them the care, but there's no payment that's tied to it. Can really struggle, help patients through this process. This is something that you really have to think through. Matter of fact, according to American Health Association, claim denials have increased by more than 20% over the past 5 years. These AI-driven systems, are they really providing better care? We don't know. The NH Predict algorithm used by United Healthcare and Humana has a reported 90% error rate, meaning 9 out of 10 appeal denials ultimately reversed. So despite this known inaccuracy, United Healthcare continues to use this system because only about 0.2% of patients appeal denial claims. So this is a huge opportunity, and we'll talk about that more in this video because I want to give you some tools that you can use today to help your patients through this process and guide them as they kind of navigate these denial process. But more importantly, if you add more value to the patients, you create more stickiness. They want to be a part of your organization and want you as a doctor because you care so much for them. This is becoming, epidemic, tremendous proportions, and we have to kind of change this around. So after watching this video, I think you are going to understand how you can navigate this with your patients in your healthcare practice. But look, just stay close attention because absolutely, I want to take some screenshots because we're going to kind of go into some things you can do to help with some of the denial claims, but more importantly, fight back. And how are we going to do this? First, you need to understand that you have to believe that there are tools that will help you win, right? You can't just give up. There are opportunities that you can absolutely win. Second, I want you to fight fire with fire. Yes, you can use AI to help you win this battle against AI. And last but not least, I want to give you some tools, guide you toward some trainings that you can do today, start learning before this denial epidemic gets even worse. I'm Theo Harvey. I'm a serial entrepreneur. Went from lowly employee to CEO who runs a multi-million-dollar healthcare business startup from his home. I raised over $1 million from VC and investors and worked with large organizations like Google, Cisco Systems, AT&T, the Charles Barkley Organization, and Blue Cross Blue Shield. My mission is to help healthcare professionals prepare for the new normal in our industry before it's too late. Let's talk a little bit about what are the tools that you can utilize today to be successful and help you win this battle versus the machines. As someone that works in this space, I absolutely believe there are tools, and I'm going to show you that can really benefit you and really increase the care that you provide to your patients and add more value, right, with some of these resources. So one of the analogies I like to use is thinking about a car. When you are in a car and you hit a slick spot in the road and you start to slid, what do they always tell you? They tell you to slide into the skid, but also keep your focus on where you ultimately want to go. Likewise, go ahead and steer into the skid of this mess of trying to deal with denials and prior authorizations, and then really keep our focus ultimately on where we want to go, which is better patient care and providing the services that they need. Bruce Lee said, the successful warrior is the average man with laser-like focus. Let's go ahead and do that focus, right? And be successful as we kind of move forward. Keep your eyes on that and not get into despair that there's nothing we can do because we're fighting against the big insurers, right? And the payers out there. So I want to talk to you about this cardiology group I worked with. They were struggling, right, to get a handle on this billing denials. When the big insurers start to clamp down and saying, is this a medical necessity? They started doing all these things. It was potentially millions of dollars lost in revenue, right? Because as we all know, if you worked in healthcare any length of time, if you submit billing, you may not hear from them for a year, but when they finally catch up, they can start going through some of your old claims and start to request that money back and denying things. And if you don't respond, they can absolutely take away from your current claims some of your revenue. And that can absolutely hurt some of these medical practices who are struggling with just trying to make ends meet with margins typically in the teens, 11, 12% of margins. So that means that they're just not making enough money to have money be taken away from them. So what this cardiology group did, they just laser focused on the problem, right? Put a team together. They focused on handling all the denials. They brought in my team to help with that process so that we can get the denials submitted, getting back records fast, and then also repeals if they had other questions, we provide that as well. And because of that, we were able to fight back against the deluge of what they were sending us. So the point is, your future will follow your focus. Let me say that again. Your future will follow your focus. Your future outcome, whether good or bad, will be determined by what you focus on. Whether you focus on the solution or the problem, it's always your choice. What I want you to do for next week, I want you to conduct a prior authorization latency audit. You want to task your administrative team with tracking the average time from actual entry to final authorization decision for your top most common requests for prior authorizations. This data is your baseline and the foundation of your business case for change. So let's get into that change like we talked about before. Next, you can absolutely fight the machines. One of my favorite movies for this was Terminator 2. If anyone has seen it, great. If you haven't, basically it's a story about how AI took over and the machines are running, man, in the future. But there was actually a strong leader named John Connor who was fighting back, and human beings were finally starting to take over for AI and win the battle. AI machines said, well, you know what? Let's just send one of our machines back to the past so we can take out this future leader, John Connor. So what did the humans do to stop AI? In Terminator 2, they absolutely sent another robot to fight a robot. So this is absolutely the case using movies as an analogy, where human beings are using AI to fight AI to win a battle. This is what's happening right now in clinics all across the country, with doctors and patients fighting against prior authorization denials using AI. They're seeing 70% success rate in overturning denials using AI-generated appeals, and appeals are processed in days instead of weeks. Dr. Paul Abramson, a San Francisco primary care physician, describes the impact. It feels like an arms race. They're using technology to delay and deny care, and now we're mustering technology to respond and produce more documentation and retaliation. So this is an ongoing battle that we're seeing more and more of. Second, medical practices are shifting from reactive denial management to proactive denial prevention using advanced technology solutions. So according to the American Medical Association, AMA, predictive analysis to flag potential denials before they occur and using comprehensive claim scrubbing technology are seeing clean claim rates exceeding 93%, reduce manual tasks by 63% because you're using automation, and the elimination of manual work in 37% of denials. Absolutely, technology is fighting back the technology. Human beings taking back their power by using these tools, right, to win back against what we're seeing. I'm going to go over how you can start doing that on my screen here of ChatGPT. We all know what that is. Created by OpenAI. It allows you to do assorted things, all kinds of great things with tools and AI to create copy and just does all the things, right, that we all know. So I'm going to go ahead and go to my screen here. I'm going to share my screen here. What we're going to talk about is When you look at my screen here, I'm showing you right here, just kind of, this is an average kind of denial that you get from insurers, right? They have the typical information, and they have the patient name, group number, and they just kind of tell the patient, after reviewing the claim submitted by provider, it gives you the service name, they set the service date, and they just tell you all the things that you tried to set it up with, and they're just telling you that basically it was denied, right? And so, um, what we're trying to show here is that, this is a scenario of a typical letter, right? And it said if you disagree with this decision, you can appeal it, which is not fun, right? There's a lot of things that go into it. And then they can kind of walk you through that. And it says submit appeal, please send a written request, including any support documentation such as medical records or letter of medical necessity from your provider. So see, this is where the healthcare professionals get involved, right? They're the ones who have to kind of provide this medical necessity letter to help the patients through this process, because if they didn't, they wouldn't get paid for it. And so, if you have any questions or about this denial to help with appeals process, please contact our customer service department, which we all know can be a pain in the butt to kind of deal with insurers, customer success department. So, what I recommend, right? Well, there is in this element. So we talked about there's claim and patient identification details, specific denial reasons, often quoting plain language, directions for appeals process, and contact information. But it's really not useful. So what do we do? So there's a prompt that you can create, and so I want you to screenshot this, and so I'm going to show you what prompt you need to do. We'll walk through it today. She can walk you through every step of it. So how you can use it. So first, I would recommend that you use the bracketed, fill in the bracketed fields. You want to paste the completed prompt into ChatGPT, hit enter, and you want to review the draft, tweak it for any clinical nuance, and then print on letterhead and attach evidence. So I think those are some of the key things that you want to start doing. So I'm going to share the prompt. So it seems kind of lengthy, but we'll walk through a little bit. So you want to always kind of preface what you think the ChatGPT, could reference itself, right? You want to kind of prepare it to kind of take on that persona of that, basically coder. You want a certified medical coder, right? And so those are the ones, the top level individuals who are out there submitting appeals for these type of claims, right? And they're certified for a reason, right? So they know what to expect, right? Okay. So then you want to draft a concise yet persuasive level 1 appeal letter to overturn an insurance denial. You don't want to go above that right now. If they do send back another request or something like that, then you can go up higher levels. And then basically start filling in these brackets. You want to have a full name, date of birth, payer name, plan type and ID, date of service. You want to do the CPT codes. You want to know the diagnosis codes, that you are. So for instance, hypertension is I-10, physician's name, and denial details. You want to know the date and the reference number that's come from your EMR. You want to know the payer language. You want to know the amount. And then you want to give the clinical justification. You want to have a brief history and current status, less than 100 words, please, and why denial service device is medically necessary. And so basically 3 bullet points. And then rebuttal talking points, right? You want to address the payer's remote. So these are the things that you don't have to fill out, right? Anything that's not bracketed, you don't have to fill out now. So all you're just telling the ChatGPT is to take on this persona. You've already kind of put your information in with your clinical justifications and denial details and information about the patient, right? The next here is just priming the AI, right? The ChatGPT to respond. And then also you want to say there's any attachment list. So you want to make sure it prints out like anything else that you need to sign or any test results or anything like that, right? And then kind of send it out. So let's put this chat into ChatGPT and kind of see what it spits out, right? So I'm gonna share my screen here. And so I'll put it in ChatGPT, and this is just a sample data, right? And so this is what it spits out, right? It gave you the name of the practice, the address and all that, gave you a date, gave you the which is the level 1 appeal that we talked about, gave you patient information, tells you the plan, date of service, the codes and everything. And then it kind of gave you the statement of medical necessity. Remember, they wanted you to kind of have some less than 100 words and kind of expanded upon that. So the ChatGPT is absolutely kind of looking at, think about, and I did a video on this, but AI algorithms are basically pulling data across the internet to kind of look at this information and find justifications for the different codes that you utilize, because it already has that data in from the internet, from reading the physician fee schedule and things like that. Also, just to let you know, ChatGPT, I'm using the O3 model. This can work as well with some of the other, this is the most advanced model. So there's a little fee associated with that, but you can use you can use 4.0, which is a little bit not as high, but it gives you the great results as well. And you can use some of the other models, right? Which I think 4.0 is a little bit cheaper or almost free, but definitely the most advanced one, especially in our industry, is one that I highly recommend. And then you want to do the rebuttal to the denial. Remember, this is something that ChatGPT is coming up with based on what you gave it. It's giving you reasons why you meet the policies, understanding, the national coverage determination, patient harm if they're denied. And that's a huge thing, right? Is the patient going to suffer undue harm for this? And to find the prior authorization on file. So, this has already been issued before. So why is it being denied previously, right? And so all this is something that you can absolutely provide to your patient right now, so they can leverage this letter and you can provide value add. If you can't do it, we can kind of help you walk through that, right? If you look below, we can help you supercharge this process, right? A free resource that you can take advantage of today is really what we call our prior authorization automation readiness checklist. And in this checklist, we're going to provide, step-by-step guidelines on like what to look for to kind of automate these type of processes so that you don't have to do it manually, right? Especially when your patients are asking you. So that resource is below, but if you want to just go straight to it, just type in sensormed.com/PA-auto to go check that out. Now we want to talk about why take action like today to win this battle. If you wait, you will see that your time increase with more and more data entry, and less time with that will be spent with patients, as we all know. Dr. Eric Topol, cardiologist, healthcare can't afford to wait. Every day we delay adopting better tools, patients pay the price. We're seeing that right now with the rise of these denials, right? Patients are paying tremendous prices to not get the care that they need and deserve. So as a healthcare professional, training is essential. So the decades of medical training you've done, right, to kind of get to your level, understanding medicine and practicing it, but also every year you're doing your continuing education units or CEUs, right, that you have to take to stay licensed. Why not take some time to train and understand business innovations, just like you do with your medical learning? Use an example. I can talk about my background. I started in this technical field, really tech heavy, on a whim, took a presentation course, right? Never thinking I would use it in a million years, right? Was thinking that I don't need this, right? This is not something for me. Why would I need it? I'm going to be deep into technology, right? But guess what? I took that one course just on how to be a better speaker, how to be a better presenter. And I guarantee that's probably generated me about $1 million in revenue over the last several years, especially as I moved more into the entrepreneurship realm. And I think the point of the story really is you need to invest ahead of revenue. So let me say that again. Invest ahead of revenue. You want to do the work now because the results will come. So take that time now to learn, to understand how to grow your business, and understand more importantly, what's happening with this denial space so that you can provide more value, but also get around other individuals that will help you accelerate your learnings in the area that you may not be as strong in. So I highly recommend, to go check out a masterclass or something that's helping you doing things to be better. For instance, we have a masterclass that's starting every quarter, and we talk about how you can grow revenue with new AI tools, as well as remote care opportunities that you're probably not taking advantage of. But this is the things that you can take advantage of now to be better and to do what you need to do to go forward for your medical practice and for your patients long term. So, don't delay. Look, the best time to plant a tree was 20 years ago. Second best time is today. It's an old Chinese proverb. You want to go ahead and do that and make that happen, because I think there's huge opportunities when you take action in the moment. I'd like to thank you for thinking through this, right? I mean, I gave you the skill set. We talked about believing that these tools exist and, focusing on the solution and not the problems, getting into the solution set and focusing on the future. We also walk you through some denial process using ChatGPT so you can create a repeal letter to kind of help your patients with some of these denials that come their way. We talked about how you can leverage some tools to help you move forward in that pathway, because I guarantee you there's going to be more and more. We talked about all the data that's coming with more and more denials. And so having this as a resource that you can use AI to fight AI is going to be helpful for you for the future. And then finally, we talked about, look, take action today, right? This is just becoming more and more worse. We're going to see more denials increasing, authorizations being rejected. So take action now so you can be prepared for that future when your patients are knocking your door asking for help because they need dire results and not just another, sorry, we can't do anything for you. Take charge, not just as a provider, but also as a business. This is an opportunity to bring something of value to your current patients. Let me ask you a question. What are you doing today to fight against prior authorization denials? Let me know in the comments below. I would love to share best practices with the community here.